Hi, I'm Arlene Phipps, and I'm going to talk today a little bit about children with intellectual disabilities, or also called mental handicaps, in the United States. People and children with mental handicaps can live very productive lives. Our society is very supportive of them. There's many laws and federal agencies with websites and phone numbers I've listed on PowerPoint to assist these families. Intellectual disabilities are very common, and factors such as low birth weight and smoking during pregnancy increase the risk that a child will have an intellectual disability. So nurse practitioners can play a big role in preventing mental handicaps by giving good prenatal care and teaching to mothers. According to the CDC, mental handicap is characterized both by significantly below average scores on tests which test intelligence, and by limitations in the ability to function in areas of daily life such as communication, self-care, and getting along in social situations. The positive side to having a mental handicap is that these children are very loving and loyal. Children with intellectual disabilities can and do learn new skills, but at a much slower rate than other children, which is why there's special education for them. Orange Grove Center, downtown Chattanooga, has approximately 700 students, approximately two-thirds white, two-thirds African American, one-third African American, and then other minorities. They have group homes throughout the city. I have a brother who actually lives at one of these group homes. He receives very good care there. Some intellectually challenged children have Down syndrome, mental retardation, and fetal alcohol syndrome, and Fragile X syndrome. Down syndrome is a chromosomal disorder, and there's more than 400,000 children and adults in America with that. Fragile X syndrome is a chromosomal abnormality and is the leading cause of intellectual challenge in boys. Children with fetal alcohol syndrome have hyperactivity and mental disorders, and unfortunately, prenatal alcohol exposure is one of the known leading causes of mental retardation in the Western world. In addition to Orange Grove School, Siskin Children's Institute in Chattanooga also work with mentally challenged children. They receive very good health care. My brother lives at one of the group homes, and the children receive very good health care. The AAIDD, or American Association on Intellectual and Developmental Disabilities, has adopted a set of principles or core values relative to its mission to protect these children. These include aiding families and other caregivers to provide support, advocating for equality and dignity and human rights for children with developmental and intellectual disabilities, and societal inclusion of these children so they can be a part of it. Goals for working with these children include quality education, stimulating home environment, positive support from friends and family, and the community enabling them to reach their full potential and lead fulfilling lives. Some of the research that I looked at showed that children with mental issues and intellectual problems had better mental health care needs met when they were on Medicare as opposed to private health insurance. And public health insurance did better than private health insurance in these children also. So this makes you wonder if we do indeed need a national health care coverage where everybody can have access to insurance. According to another study, children with special health care needs or chronic health conditions, which constitutes about 15 to 20% of all American children, also have a high need for mental health care, and 37% had high unmet needs for mental health care. It also showed that poor and African American children had higher unmet mental health care needs. Nurse practitioners can play a big role in helping these children, supporting them and their families, and preventing mental handicaps. Thank you.